Good morning! If you have decided to study and you want to become a professional hypnotherapist, keep watching our training videos about clinical hypnosis. Hypnotherapy is an effective technique with which you can help and improve the quality of life of a great number of your future patients. Remember, read the description of this video where you can find a link to free training classes on clinical hypnosis. And also, you can download some ebooks also free. The information of this video is extracted from our book Direct Clinical Hypnosis, Deep Hypnosis, of our publisher Clinical Hypnotherapy, registered with ISBN. Hyperthermia in Direct Clinical Hypnosis. Operation Part 2. Hyperthermia functioning. In direct clinical hypnosis, the best way to produce hyperthermia is to send an induction to the brain to produce a heating in a specific area. We know how to isolate an area of the human body by placing our hands. Tactile sensation through the therapist's hand. Using verbal inductions while the patient visualizes the heat-inducing visualizations. Flamethrower, hot rod, fire, abrasive acid, and volcano for larger areas. These 5 heat-inducing visualizations are the ones used in hypothermia. Increases the temperature of the interior between 45–48 Celsius degree with an appreciation of +3 Celsius degree. The temperature achieved is real. It is achieved by the visualizations. This is due to the fact that the muscular zone closest to the area to be treated is excited. Heat that is produced by muscular vibration. Keeping in mind that only the isolated area is heated, hence the importance of isolating the area with our hands, this will only increase the temperature in that area. The therapist feels the induced heat by capturing the temperature increase in his own hands and by feeling the vibration of the area, very similar to when you shiver. A revascularization reaction occurs in the areas lateral to the insulation, acting as a cooling reaction, thus ensuring that only the area covered by the hands insulated is heated, without the surrounding area being affected by the heat. Cancer cells are thermosensitive. That is to say, they are more sensitive to heat than non-cancer cells. Cancer cells succumb much earlier to the heat. They also have a higher pH, so they are better conductors of heat than other cells. Approximately 30–35% of cases treated by hypothermia show a complete disappearance of the carcinoma. Therapeutic failure is due to poor visualization of the patient or poor application of visualization by the therapist. If the patient has metastasis, the chances of therapeutic success are practically nil or very slim, because the cancer has spread throughout the body. Hypothermia is a perfectly accepted medical principle. There is an infinity of electromagnetic devices in charge of producing a temperature increase. The novelty in direct clinical hypnosis is the induction of this heat by means of deep hypnosis and, of course, without the need of using any device. The problem with the use of electromagnetic hypothermia is that when we remove the device, the temperature increase ends, as it is the application of external heat. With hypnosis, the temperature is maintained for the whole week, that is to say, until the next session. This is achieved by means of the post-hypnotic order applied to the patient. Use of hypothermia. Hypothermia is used for muscular injuries, joint injuries, sprains, strains, muscle tears, joint pains, organic stimulation, etc. But the most innovative is its use in the field of oncology. If you're interested in learning more about clinical hypnosis, watch our next video, Hyperthermia Indirect Clinical Hypnosis, Scripts and Exercises Used. Remember, read the description of this video where you can find a link to free training classes on clinical hypnosis, and also you can download several ebooks also free. If you have any questions, add them in the comments area. On this topic and many others we'll talk about in the channel and in the videos that we'll publish. So, if you're interested, do not miss our next videos. Thank you very much.